Prevention instead of cure is a big part of the NHS 10-year plan, and allied healthcare professionals have a massive part to play in that.
I think one of the most fulfilling parts of my role is I love working as part of a multidisciplinary team.
Allied health professionals, or AHPs as they're known, play a vital role in the care we provide every day. From physiotherapists and occupational therapists to radiographers, dieticians and many, many more, AHPs support patients at almost every stage of their hospital journey. Today, we're shining a light on their expertise and the essential contribution they make to our patients here at the Trust.
An allied health professional is someone that works within the healthcare scope, but would be a little bit more specialised in a specific area.
There's a wide range of allied health professionals out there. Dieticians, speech and language therapists, other physiotherapists, occupational therapists, orthotists. So yeah, real broad spectrum. So if you just come over to the worktop, so kitchen worktop. So I decided I wanted to be a physio when I was 11 years old. I went along to a physiotherapy appointment with my mum, and I was just inspired by the physio that she saw. Okay, so we're doing this exercise here, so just step. I think one of the most fulfilling parts of my role, if I reflect on what I do day to day, is I love working as part of a multidisciplinary team.
Because we're so specialised, we need to use other healthcare professionals to kind of work towards a similar goal. And a lot of allied healthcare professionals will work in multidisciplinary teams.
I get to work with specialist multiple sclerosis nurses in a clinic, seeing the patient jointly and alongside my occupational therapy colleague. Once a month I work up at Marie Curie Hospice as part of a wider multidisciplinary team. So obviously I work alongside BICO, we do a neurological multidisciplinary orthotics clinic.
So we've got a referral from your GP about a foot drop, I believe, and this is a multidisciplinary team with Amanda and myself, and we kind of put our brains...
So when we can do it jointly, it just improves the timing of our therapy, as well as the patient only having to tell their story once, and we can put our heads together, that real shared clinical reasoning, decision making.
It's a lot more of a holistic treatment and a whole patient, whole person treatment. I grew up in Malawi, sub-Saharan Africa, and there the provision for prosthetic and orthotic services is really low. So you have people crawling on the street because their contractures had gotten so bad and the management was so bad that they were unable to mobilise normally. So for me, with a mum who's a physio and a dad who's an engineer, that kind of linked up straight away. Prevention instead of cure is a big part of the NHS 10-year plan, and allied healthcare professionals have a massive part to play in that. Dieticians, for example, would be helping people with diabetes. If that's managed well, then hopefully their symptoms of neuropathy and things would be reduced, and therefore reduced risk of ulceration, then amputation, and then XYZ from there.
But working in that clinic setting with other healthcare professionals, one, obviously there is the support from each other, two, that shared decision making alongside the patient and their family, their carers, to try and get the best outcome for them.
I really like it when consultants or GPs or physios or whoever else have questions and think, ooh, would this be something that you would be able to help with? Yes and no. Improving that communication with us and with other healthcare professionals is really important, because that's the way that we can get the patients the best care. Bring your heel back, please. It's just a massive thing to know that you are impacting a patient's life in such a positive way to reduce falls and improve their mobility and their overall quality of life, I guess.